If your monthly period feels like a mini war in your abdomen, you're not alone. But what if I told you that not all period pain is normal? Some of it can actually be a medical warning, sign your body has been whispering or screaming about for years. Welcome to Clarivive MedInsight, where we talk about the women health. Today we're breaking down dysmenorrhea, not just the fancy medical term for period cramps, but the science, the causes, the red flags, and the real solutions that can change your quality of life. Dysmenorrhea simply means painful menstruation, but in medicine, we divide it into two types. Primary dysmenorrhea, painful periods without any underlying pelvic disease. Usually starts within 6 to 12 months after menarche, the first period. Secondary dysmenorrhea, painful periods caused by an underlying condition, such as endometriosis, adenomyosis, fibroids, or pelvic inflammatory disease. In primary dysmenorrhea, the main culprit is prostaglandins hormone, like chemicals released by the endometrium before and during menstruation. High levels of prostaglandin F2A cause the uterine muscles to contract harder and blood vessels to constrict. This reduces oxygen supply to uterine tissue, resulting in triggering that familiar cramping pain. In secondary dysmenorrhea, the pathology depends on the underlying condition. Endometriosis, endometrial tissue, grows outside the uterus, responding to hormones and bleeding in places it shouldn't. Adenomyosis, endometrial glands grow into the uterine muscle wall, making periods heavier and more painful. Fibroids, benign tumors in the uterus can increase cramping and bleeding. Primary dysmenorrhea symptoms. Pain starts 1 to 2 days before bleeding, peaks within the first 24 hours. Improves as bleeding lightens, usually no abnormal bleeding or discharge. Secondary dysmenorrhea symptoms. Pain often starts earlier in the cycle and lasts longer, may be associated with heavy bleeding, irregular cycles, pelvic pain outside menstruation, painful intercourse. Worsens over time instead of improving with age. Medical management or what doctors recommend. NSAIDs, ibuprofen, naproxen. Block prostaglandin production. Start 1-2 days before expected period for best results. Hormonal management. Combined oral contraceptives. Regulate hormones and reduce endometrial lining thickness, also lowering prostaglandin release. Progestin-only methods. Pills, injectables, hormonal IUDs, levonorgestrel. Secondary causes require targeted treatment. Endometriosis may need laparoscopy or hormonal suppression. Fibroids, myomectomy or hysterectomy in severe cases. Non-medical and lifestyle management. Heat therapy. Heat pads improve blood flow and relax muscles. Exercise releases endorphins, which are natural painkillers. Diet, anti-inflammatory foods, omega-3s, leafy greens, berries. Stress reduction, yoga, meditation can lower muscle tension. Acupuncture, some evidence supports its role in pain relief. Seek professional care if pain is worsening over time, periods are excessively heavy, pain persists even with NSAIDs and hormonal treatment, you have pain during intercourse or outside your period. These could be signs of secondary dysmenorrhea needing further evaluation. Let's talk about some common myths. Painful periods are just part of being a woman. Not true. Severe pain isn't normal. Having a baby will fix it. No guarantee. Some women still experience pain after childbirth. Early diagnosis and proper management can significantly improve quality of life. Pain during periods should not be something you just learn to live with. Understanding whether your dysmenorrhea is primary or secondary is the first step toward real relief and reclaiming your life every month. In our next video, we'll explore menorrhagia, when heavy periods go beyond normal, what causes them, and how they can be managed effectively. If you like this video, then share it to someone who really needs it. And in the comment, tell us about your experience with dysmenorrhea. Like and subscribe to Clarivive MedInsight for more trusted health info. Thanks for watching.